you all for joining us today. My name is Tracy Stewart. I'm the Senior Director of Outreach and Recruitment for the Association of Schools and Programs of Public Health. I'm very excited to be moderating the session today. Just so you know, you can ask questions at any point during the session through the chat. Just use the chat feature on the bottom of your screen. We will be taking general questions about MPH or other public health degrees during the first part of the hour. When we go into breakout rooms, you'll have the chance to talk about specifics about each school and program that's with us today. So just so you know, there's a way to change your view so that you don't see other participants, but we will also be spotlighting the speaker for the sessions. So with us today, we have Cornell University MPH program, Mercer University Department of Public Health, University of Delaware MPH program, University of Nevada, Reno School of Public Health, University of North Carolina, Gilling School of Public Health, and West Virginia University School of Public Health. Unfortunately, the University of Nebraska is unable to make the session today, but please check out their website, which I will drop in the chat, and to be in touch with their admissions office or to check for any upcoming events. Okay, with that, we'll stop sharing and turn it over to Cornell University. Thank you. Oh, we can't hear you, Adrian.
Now you can hear me. I apologize about that. Yeah, so my name is Adrian Gutierrez, and I'm the admissions counselor for the Cornell Master of Public Health program. We're now accepting applications for the fall and summer of 2023. So if you want to make an impact in public health, advance health and well-being for all, and really change the world, we'll help you. So please check us out. So here at Cornell, we approach public health differently. We understand that public health is all around us, is a part of all of us. And there is really a dire need for public health practitioners who are able to identify, understand, and solve the greatest challenges over time. Essentially, our collective health and well-being is under strain. So we're seeing that climate change is driving risk and vulnerabilities, unsustainable environmental use is influencing the emergence of new infectious diseases, systemic social and environmental injustices compound health impacts among the most vulnerable populations. So we need to change the status quo. We need to understand the systems that are in place that impede or support the advancements of public health and well-being. And this is what we do at Cornell. So our strategy is to develop public health leaders who take a systems-based and transdisciplinary approach to address and improve local, regional, and/or international health issues. They prioritize intervention to reduce morbidity, mortality, and burden. They support population health systems that ensure equitable access to resources and paying close attention to the determinants of health, the environment, education, economics, community cohesion, healthcare. And this is how they lead change. This is how they become part of the new generation of public health leaders. So come join us. The program itself at its core is founded on sustainability, equity, and engagement. We understand that public health is a discipline that bridges different professions to promote health and well-being and prolong life among populations. And our mission is to advance health and well-being in a way that is equitable for all and sustainable for the environment. We use the One Health and Planetary approach frameworks. Humanity's greatest challenges, they stem from the unsustainable ways that we interact with the environment and the inequitable ways that we interact with each other in different communities. So human health is fully integrated with the health of the environment, including animals and plants, and really biodiversity. So we're trying to approach public health in that way. We offer small class sizes, so we are a very small program intentionally because we want to make sure that you get team-based learning. We want to make sure that we give you focused attention to developing your skills and competencies in different areas of public health. And this is where small teams of students do hands-on work with a faculty member and also an external partner. We also have an amazing interdisciplinary faculty. Cornell University is the largest Ivy League school, and we really make good use of our resources. We have 30+ core faculty and staff members in the program. We have 50+ partner faculty from across Cornell in the different campuses or different schools on campus, but also Weill Cornell Medicine in New York City, taking part in our MPH instruction, activities, and research to advance public health. We also have an integrated curriculum, and this is where you develop strategic skills in different areas like quantitative sciences, social sciences, professional methods, public health sciences, and I'm more than happy to share our curriculum later after this presentation. Our team is really committed to a community engaged learning approach throughout the MPH curriculum, and this is where we focus on transitional skills and core public health competencies. You pretty much learn the practice of public health by working on real world data and problems, but contributing valuable work to public health organizations. And this is how you create a change. This is how you become a community of practice where we push each other to grow and improve in both traditional public health knowledge areas, but also in professional competence, soft skills, leadership, emotional intelligence, cultural competence. So program details very quickly. So we're located in Ithaca, New York, the beautiful Finger Lakes region of New York State. We have two options of study. We have a standard 2-year program with a fall start date, but we also have an accelerated 1-year program with a summer start date. We have 2 concentration areas. We have infectious disease epidemiology and also food systems and health. And again, I'm more than happy to share the topics that we study and discuss in different concentrations. And then this is to show where our students go after they graduate. So we're 97% of our students secure employment or pursue advanced training within a year from commencement. So before they even graduate, they get employed. And this is the way that we build the curriculum, is so that our students place themselves in areas where they can make an impact, where they can make a change, where they can promote health and well-being. Some of them work in private organizations, government, healthcare, nonprofits, public health roles. They leave us as public health epidemiologists or program managers, and I'm more than happy to share that newsletter with you at the end of this presentation. So admissions requirements, it's very simple. It's on SOPAs primarily. So we need transcripts, resume, personal statement, statement of intent, 3 letters of reference. If you're an international student, then we require transcript evaluations from WES, TOEFL, and then a supplemental Cornell graduate school application. The deadlines are at the bottom. For the standard program is May 15th. For the accelerated is April 1st. What makes a competitive application? Strong letters of recommendation, background experience, strong understanding of public health, career goals, and aspirations. And this is where we want to know how you want to make a change, how you want to impact public health. Where is that passion? That, what drives you to improve the area of public health, and also to improve, public health in different communities or your community, right? Cost and funding for the 2-year program. Well, actually, it's $20,444 per semester, and that's just a sticker price. No fees will be added. Actually, nobody pays that much because we have a scholarship that every admitted student qualifies for, and it covers about 25% of the tuition costs, on top of any other funding opportunities that we provide you with. And then Ithaca is a beautiful area. It's the land of gorges, waterfalls, and outdoor beauty. It's a community of academics, artists, adventurers. It's a wine region of New York State with culturally diverse foods. So please come check us out. And then if you have any questions, here is my team. Ben Parker, Manager of Student Services, Katie Lesser, Student Services Assistant, and myself, Adrian Gutierrez, Admissions Counselor. So that's the end of my presentation, and now I will pass it along to Mercer University.
Good afternoon. Adrian, could you please stop sharing your screen?
Yeah, I'm trying to do that right now, but it's
okay. Thank you.
There we go.
Thank you. So good afternoon. I'm Dr. Cheryl Gaddis. I'm chair of the Department of Public Health and also the MPH program director at Mercer University. So thank you for the opportunity to share information about our programs with you today. The graduate programs at Mercer University are offered in North Atlanta in close proximity to world-class restaurants, a myriad of cultural attractions, and very active nightlife, sporting events, as well as many historic destinations. The campus caters to graduate students and provides a beautiful and peaceful atmosphere for classes as well as for studying. Campus housing is also offered for our graduate students, including the newly built Mercer Village Lofts, which is pictured in the top right here. I'm focused on diverse populations and health equity. We offer a Bachelor of Science in Public Health on the Macon campus, but our graduate programs are offered on the Atlanta campus. So the Master of Public Health program is offered in Atlanta, Georgia. Additionally, combined degree programs allow students to earn the MPH degree along with doctoral degrees in pharmacy, physical therapy, and psychology, or along with the master's degree in medical science. The Doctor of Public Health degree is offered on the Atlanta campus as well with two concentrations, social epidemiology or diverse populations and health equity. Social epidemiology concentration students will be prepared to quantify social and structural determinants of health to demonstrate the effects of privilege, racism, and other injustices on the health of diverse populations. Those students who are enrolled in a diverse population and health equity concentration will be prepared to lead organizations and design, implement, and evaluate health programs that are envisioned to benefit disadvantaged and minority groups to achieve health equity. The admissions requirements for our MPH program requires that you do submit your application through SOFIS, the Schools of Public Health Application Services. The deadline for the MPH program is July 1st, and so we are accepting applications at this time. You do not have to take the GRE and submit those scores to apply for our MPH program. And we do have a fall start date for this particular program. The admissions requirements for our DRPH program also requires that you apply through SOFIS. The deadline for the DRPH program is October 1st. And again, for the DRPH program, you do not have to submit GRE scores. And we have a spring semester start date for the DRPH program. So something to please take note of. The program schedule for our Master of Public Health program allows students to complete the MPH degree in 2 academic years, which is equivalent to 5 consecutive semesters. We do offer an accelerated program as well for students who may want to complete that Master's of Public Health degree in 1 year, which is also equivalent to 3 consecutive semesters. Our classes are conveniently held for those who want to continue working throughout the day. So our classes are held in the evenings during fall and spring semester. The classes are held Monday through Thursday from 6 to 9 p.m. And then in the summer, because it is a shorter semester, on-campus courses are held from 6 to 10 p.m. However, most of our courses in the summers are held online. We offer the Master of Public Health program in 3 different formats. You can complete the program online, completely online, or you can do face-to-face on-campus courses. You can also complete the program in a hybrid format where you may be taking some campus courses as well as some online courses. And then some of the courses themselves are offered in a hybrid fashion as well. For the Doctor of Public Health program, students can complete that degree within 2 1/2 academic years, which is also equivalent to 7 consecutive semesters. The class times are the same as for our Master of Public Health. They're held in the evening because we do understand that people may want to continue working full-time as they're pursuing their doctoral degree. The classes are held in the fall and spring from 6 to 9 p.m. Monday through Thursday, and in the summer, again, 6 to 10 p.m. Now, the class format for the Doctor of Public Health will depend on which concentration you're doing. So if you choose social epidemiology, then your classes will be on campus. However, if you choose the diverse populations and health equity concentration, all of your classes will be online. So students fund their degree in various ways. Many take out loans, they have scholarships, as well as some grant opportunities that they pursue. We also have students who work part-time. As I mentioned, we do have many of our students who continue to work full-time. And we also offer work study and graduate assistantships to our students, and they can use those funds to help pay for their degree. So why should you choose Mercer? Well, Mercer is recognized as a national leader in health education. We are CEF accredited, and CEF recognizes Mercer's steadfast commitments to excellence in teaching, research, and service. We do not have a cap for our admissions, and we try to keep our class sizes smaller and more personable so that there's usually 20 to 25 students, allowing you direct interaction with the faculty. The program offerings are also unique from those that are offered at other colleges and universities. And so these concentrations are not typically found at most schools that offer MPH and DRPH degrees, giving our graduates an advantage in the public health workforce. Also, students who graduate from our program have a variety of opportunities for careers. Those students who graduate with the MPH degree are prepared to be competent health professionals who are trained and qualified to work in diverse communities, both locally as well as globally. And our DRPH graduates are able to engage in evidence-based public health practice to effect changes across a range of settings. So the admissions email addresses are provided here, as well as the website for our Department of Public Health. And I hope that you will join our breakout room to learn more about our programs. And now I'll turn the presentation over to the University of Delaware.
Thank you. There we go. All right, thank you. My name is Lauren Camphausen, and I am the MPH Program Manager at the University of Delaware, and I'm very, very happy to be here today to talk a little bit about our program and to connect with you all. Let me just start by pointing out where Delaware is located. It has helped that our current president is from the state of Delaware, so now I think more people are aware of our small state's existence and where we're located. But we are fortunate, our campus is in Newark, Delaware, and we're fortunate to be centrally located between New York City and Washington, D.C., which allows for a lot of regional collaboration for our faculty and our students here at UD.
I don't know if you wanted to switch to presenter mode.
Oh, did it not? I'm sorry. Thank you so much. There we go. Our MPH program, well, UD as a whole currently has about 4,500 graduate students, and that population is continuing to grow year after year. There's been a huge emphasis in the last several years at UD on growing and supporting the graduate education programs here at the university. Our MPH program has approximately 50 students across 2 concentrations. And we purposely keep our cohorts on the smaller side so that we're able to foster a strong community among our students and ensure that our students receive very hands-on support from our faculty, our staff, whether that be their academic advising, career counseling, or offering that holistic support. Our program is 42 credits. We're a professional non-thesis degree. We offer 2 concentrations here at the University of Delaware in epidemiology and health policy and management. What's interesting about our program here at UD is our concentrations, epidemiology and health policy and management, reside in 2 separate colleges. So epidemiology resides in the College of Health Sciences. And so our program interacts more in the health education sphere and those health spheres and those health sciences spheres, whereas our health policy and management resides in the Biden School, which is named for our current president, and really has access to a lot of that public policy and administration focus in that concentration. However, it's an interdisciplinary degree. So the 2 concentrations share pretty much the entire first year of the program. So our students in epidemiology have access to that policy and public administration focus. And likewise, our health policy students have access to that health science focus. Our epidemiology program is located at the university's new and developing STAR campus. And it's a really great state-of-the-art facility that it is purposely designed to be very interdisciplinary, very modern in its hands-on approach to learning and experiences, and is actually built to be purposely co-located with industry as well, with our academic programs. So we have a really big focus within our UD MPH program on connecting students to opportunities and experiences to really build that professional development side of their degree to complement the academic pieces of the curriculum. And we do that through a variety of ways. We have an Epi Assist program where students on both the epidemiology side and health policy and management side can join and be part of being on call for different public health surge needs or various projects or requests that we get from our public health partners in the community. We are also co-located with the University of Delaware's Partnership for Healthy Communities, which is what we like to refer to as kind of the clinic for public health. So they're really a bridge for students and faculty from the academic space to our community partners, so that we're working collaboratively on public health issues and concerns within our communities in Delaware. And we also house in the epidemiology program the University of Delaware's Biostatistics Core. And so we offer support to faculty, doctoral students, and anyone on biostatistics needs they may have for grant preparation or research projects and research design, as well as we provide teaching assistantships to our various biostatistics courses, and we provide tutoring and academic support around biostatistics. We are establishing ourselves with our public health partners to have our students be available for public health surge response. And this really expanded during the COVID pandemic around our students being engaged in helping with contact tracing for the state, as well as vaccine administration, both in the surrounding state with our public health partners, as well as providing support to our campus response. And we also engage our students on the research side and get our Master of Public Health students engaged in a lot of research opportunities. So while it's a professional degree, we really do provide opportunities for our MPH students to work with faculty on their various research projects. We really, again, as I said, there's a big focus on providing opportunities for those crucial professional connections. In fact, one clear example is our students are, as we speak, currently working with the Delaware's Public Health Department on conducting their state health needs assessment that's required for their accreditation to inform updates to Delaware State Health Improvement Plan. So really being able to not only make those professional connections, but practice those essential public health services in the community and on the ground. And we boast nearly 100% of our students who are seeking employment post-graduation do secure that employment. Our application requirements are pretty standard. We are in SOFAS and we keep things pretty simple. We do not require a GRE. Basically, we would like applicants to come with a bachelor's degree in any discipline. We're pretty holistic with that. Resume, 2 letters of recommendation, a statement of purpose, kind of why public health, why are you interested in that? And then for our international students, the TOEFL scores. There is also a brief UD supplemental application that's required on our university side. We do holistic review of these applications. So even if you're not necessarily meeting that 3.0 GPA, we do encourage students to still apply because we take a lot of factors into consideration when we review applications. So this is my contact info, but before I finish, let's talk a little bit about funding opportunities for our students. While they're not structured the same as PhD students coming into the university, which are admitted with guaranteed funding, we do provide various funding opportunities to students who are applying to our program. And those range from research assistantships on faculty research to various graduate assistantship positions like assisting the department with social media, or engaging in some of the program support kind of things. And we do have a teaching assistant position for our second year MPH students to be teaching assistants in some of those first year classes, as well as some undergraduate classes that we support. So I think that is it. This is my contact information. If you would like to reach out to me or join the breakout, and I'm happy to go into detail on any more specific information folks may have. So let me turn it over to University of Nevada, Reno. Stop sharing.
There we go. Thank you, everyone. My name is Kristen Clements-Knoll, and I am the graduate director for the School of Public Health at the University of Nevada, Reno. And the university is located at the base of the Sierra Nevada mountains. So a lot of people think we're in Las Vegas in the desert, but we're actually located quite closely to Lake Tahoe, about a 45-minute drive from Lake Tahoe, less than 4 hours from San Francisco in the Napa-Sonoma area. And we have year-round recreational activities. We're very well known for our recreational activities in summer, winter, and fall, including world-class hiking, biking, skiing, and snowboarding. Nevada, and in Reno in particular, is also really undergoing a lot of economic renaissance, and there's a lot of businesses who've located to the Reno area and have very close partnerships with our university, which has created a lot of opportunities for our students. So UNR is a land grant institution, which means, I think somebody probably needs to mute there. Sorry. Which means we not only educate our students, sorry. Can we do an automatic mute of others? Is that possible? There we go. So we not only engage in scholarly work, but we really give back to our community. We're recognized as a Carnegie R1 very high research activity university. And the School of Public Health is one of the most actively engaged in research and most productive on campus. We've also received the Carnegie classification for community engagement. And as you'll see in later sessions, we really engage with our communities locally, nationally, and internationally. So we are a fully accredited School of Public Health, and all degrees of the bachelor's, master's, and doctoral programs are CEF accredited. We have a Master of Public Health in Epidemiology, an MPH in Health Administration and Policy, MPH in Social and Behavioral Health, and we have a 100% online MPH, which is our Public Health Practice degree program. We also have a Master of Science in Health Analytics and Biostatistics and a Master of Science in Kinesiology. And we have 2 PhD programs, one in epidemiology and one in social and behavioral health. We also have a number of joint degree programs, such as the MD MPH program, and we have an accelerated bachelor's to master's program. So our faculty are very engaged in research, as I mentioned before, and have a great deal of funding from national, international, and local areas. But what's really unique about our program is we fully engage students at all levels in applied research opportunities. These are just some of the clusters where we have expertise within our school. And a number of our master's students, as well as even our bachelor's students, are actively involved in working with research professors on their grant activities. And we really help mentor students to be able to present at national conferences. We have a funding mechanism to support that growth. And a number of our students at the master's and bachelor's level come out with publications and national presentations as well. At our doctoral program, this is obviously a very large component, and all of our doctoral students are fully funded on either research funding or teaching assistant funding. We have a number of different opportunities for our students. So we have several global health initiatives that are back on track now post COVID lockdown. We have a very successful student internship program. Most of our students at the master's level have paid internships, both locally, but also nationally and internationally. And many of those opportunities end up transferring to be employment for our students. About 98% of our students are fully employed in public health within 6 months of graduation. We also have a lot of funding opportunities for our students. I'll talk a little bit more about our cost breakdown in a moment. But we have graduate assistant positions, both research-based and teaching-based, that are open to our master's students as well as our doctoral students. And our students have done very well in fellowship applications. The faculty really support students and are continually putting them up for awards, and our students have done very well with some of these scholarships and merit graduate student awards. We also have ongoing professional development throughout the semester. Each semester we have a number of different sessions that help our students with their professional development, create networking opportunities. So really engage with the communities and try to sort of build those workforce skills. So our tuition at the university is very affordable compared to a lot of universities in the West, but also across the nation. So for residents of Nevada, tuition is approximately $5,000 per semester. And for non-residents, it's $13,000 and just under $13,000 for international students. Any student who receives a graduate teaching position or graduate research assistant position would qualify for the resident level tuition. So even without the resident level tuition, our tuition is very affordable. We also participate in the Western Regional Graduate Program. And these are the states and the Pacific territories that would qualify for this program. So it's really all the neighboring Western states and territories, and Western and more Central Western and up the Pacific coast. Any students from any of these states qualify for that in-state tuition. So many schools, it'll be about 150% of tuition, but at our university, that would be in-state tuition. So automatically you would qualify for this $5,000 resident tuition. So our application system is similar to most of the schools who have presented today so far. Our primary application is through SOFAS. We are open and actively evaluating applications. We have rolling admissions, so students, once an application is complete, students will usually hear from us within about 2 weeks. We also have a supplemental graduate school application, and we pay the university, our School of Public Health actually pays the fee for that application, but it's just a simple questionnaire. Our priority deadline is February 1st, but this is really just to be in the best possible position for funding and for GA positions. But we will, continue reviewing applications until June 1st, complete applications until June 1st. And it's not to say that if you miss the February 1st deadline, you wouldn't be eligible for some of those opportunities. There are just some deadlines that are earlier at our university. We do not require the GRE for any of our Master of Public Health programs. However, we do require the GRE for the PhD programs. And for students, international students that are not from an English-speaking country, we require an English proficiency exam. We encourage use of Duolingo because it's easier for students and it's much cheaper. 3 letters of recommendation, a statement of purpose, and your resume. Again, all of those materials would be submitted through SOPUS. So here is my contact information, and I've also listed contact information for Samantha Dunning, who is a current second year MPH student. And Samantha will be joining us in the breakout room. So it's a really great opportunity to learn directly from one of our excellent students in the program. I hope you'll be willing to join us. All right, now I will turn it over to University of North Carolina, UNC Chapel Hill.
Great, thank you. Okay, welcome everyone. My name is Crystal Isler. I am the Assistant Director of Admissions at the UNC Gillings School of Global Public Health. We are located in Chapel Hill, North Carolina, and so I will share a little bit about our degree programs, what makes Gillings unique, and share about our application process and funding as well. So a few quick facts about Gillings so that you can get a quick overview of the school and what we offer. We are the #1 public school of public health and #2 school of public health overall, including public and private institutions. And we like to share that just to give you an idea of the quality of education that students do receive at Gillings. The student enrollment is a little over 2,400 in all, according to fall 2022. And we have different strategic initiatives that focus on topics such as cancer, global health, health disparities, obesity, water. But if you are interested in research and kind of research-based degrees, we do have a research section on our website where you can organize it by department and really see the specific research that faculty is involved in. And I'll share our specific website at the very end. We also have a commitment to inclusive excellence. We have an inclusive excellence team that includes about 5 staff members. We also have an inclusive excellence council that consists of staff, faculty, and students. And so it's really making sure that we are constantly striving and working towards an inclusive environment at the school. And just a little bit about research at Gillings. You know, we've received over $1 billion in research dollars since 2016, and also are the top public school of public health for NIH funding as well. A few other factors that I think really show the culture of Gillings and the experience for students. And we do have world-class faculty that are really involved in the local and global community. And many of our faculty members were involved, you know, during the height of the pandemic with just, you know, talking through solutions and thinking through how to support leaders at the state and national level. And so our faculty are really involved, you know, not only locally, but also on the national and global level as well. We have a variety of different degree options that include MPH degrees. We have an MHA. We have more research-based degrees, which include our MS and MSPH, and also doctoral degrees as well. So there's a variety of different options based on your interest. Faculty and staff support. Each student is assigned an academic coordinator and also faculty mentor as well. So they have both of that staff and faculty support throughout. We are located near the Research Triangle. And so students have that opportunity to experience their practicum or internship opportunities at these local companies and also with different types of healthcare entities as well that are in the Research Triangle area. We also collaborate with our other health professional schools as well at UNC. Our School of Medicine, School of Pharmacy, School of Nursing, and School of Dentistry are all located in walking distance. And so we have those close collaborations with the other health professional schools as well. And then there are numerous student-led organizations at Gillings, student support pods as well, so that students have that support at the student level and the peer level. This is a quick overview of the degrees that we offer, including our MPH degree. We offer a residential and an online MPH. We also offer our UNC Asheville, UNC Gillings MPH joint degree. This program is located in Asheville, North Carolina, and is a joint degree with UNC Asheville. And it focuses more on a place-based concentration. We also have additional master's degrees, our MHA, and our more research-based degrees. We have master's to doctoral options that are more specific to limited departments. And then we also have our doctoral degrees. We offer our PhD degrees, and then our DRPH, which is our only online doctoral program. Our Master of Public Health, we do offer 13 different concentrations. So there are numerous opportunities for you to specialize in a specific area within public health. So we offer concentrations from applied epidemiology to health behavior, to health policy, nutrition, public health data science. So there are numerous options for students based on your interest. And just keep in mind, if you are interested in the online MPH, we only offer limited concentrations within that format. And for our doctoral programs, we do offer PhD programs in each one of our different departments. And so you can see the different departments that are at Gillings, from biostatistics to maternal and child health to epidemiology. And so we do offer PhD programs in each one of those departments. For our MPH application for fall 2023, we do have 2 upcoming deadlines. Our priority deadline is in early December. Our final deadline is in early February. Please keep in mind that we do utilize SOFIS, and then we also have a UNC Graduate School supplemental application as well. So there is a 2-step application process for the residential MPH program. And then our application requirements just consist of aspects such as your transcripts, 3 letters of recommendation, statement of purpose, resume, and then if you are an international, and if we can just mute, yes, thank you. And so we do have international applicants as well. The TOEFL or IELTS is required unless you meet certain exceptions. So we do have exceptions for that that are listed on our graduate school website. And then international applicants do not have to submit an English proficiency exam. And so for our other programs, such as our additional master's degrees and then our doctoral programs, those deadlines are going to vary depending on the program. But we do have a listing on our graduate school website of all of those deadlines and requirements based on the individual program as well. In terms of funding and financial aid, we do offer different types of funding at the university level, at the Gillings school level, and then the department concentration level. And so that can consist of merit scholarships. We do have assistantships that are available as well. And we have a job posting site that those assistantship opportunities are typically posted, and students can review the specifics of those assistantships and apply for those directly. And then, of course, if students are eligible for federal aid as well. And so if you are interested in learning more about UNC Gillings, I did want to make you aware that we do have a virtual graduate programs open house that's happening tomorrow. And so I will put the link also in the chat, but there's a QR code if you want to scan that and go and register for that event. And that's a great way for you just to learn more about your specific program interest. And then here is additional information, including our website, our admissions email address, and then our social media sites as well. I always think it's helpful to follow schools on their social media accounts because you can really get a feel for what's happening at the school level. Gillings has different events all of the time that are open to the public, so you can really learn from faculty, staff members, and get a feel for the culture. Okay, so thank you, and I look forward to talking with more of you in the breakout rooms. And I will now pass it to Lauren at West Virginia University.
Okay. Can everyone see my presentation?
Yes.
Okay, thank you. So I'm going to talk to you a little bit about the programs for the WVU School of Public Health. My name is Lauren Devine. I'm the Director of Admissions and Recruitment for the school. So I'm your first kind of contact if you're interested in any of our programs. I also run our Student Ambassador organization. And if you would like connected with any of our current students, we have ambassadors in each area and they're really great wealth of information. And they also generate a lot of the content that is on our School of Public Health Instagram. So if you see anything on there, that's a lot of them. They take great pride in everything that they post, and they do a lot of a day in the life takeovers, and we have past ambassadors who do a lot of alumni takeovers as well. So if you're not familiar, WVU is located in Morgantown, West Virginia. So we are at the very top of the state, right on the border of PA. We're about an hour and 15 minutes from Pittsburgh, Pennsylvania. We are located in the mountains, so we have a lot of outdoor activities very close to campus, but we also have a very nice campus. And we are very rooted in Appalachia and Appalachian culture, and a lot of our research and things surround that. We are an R1 research university at WVU. We have 480 student organizations. 82% of our faculty across the board hold the highest degree in their field. We've earned the Carnegie Foundation's community engagement classification based off of service given back to the community. We have last year, we had over 147,000 hours of community service given back. We have 3 campuses on the Morgantown campus. So School of Public Health is located on the Health Sciences campus, which is also where medicine, nursing, dentistry, and pharmacy are. And we have 18 intercollegiate sports that compete in the Big 12 conference. So the School of Public Health is the only accredited public health program in the state of West Virginia. We've added 2 new programs this past year. And we really like to kind of focus on 4 main things when we talk about our school. Our location and access being on the Health Sciences campus. We are connected to the largest hospital system in the state on our campus. We have the county health department right in front of campus, and we have the National Institute of Occupational Safety and Health right behind our campus. So we're at a really great location for everything going on public health wise. We like to set high standards for our students. We like to get you involved in research. All of those students that were in the picture that I showed on my introduction slide all got to go to APHA just a week or so ago in Boston and present research that they've been working on. We have expert faculty in the field. A lot of our faculty are doing research across the field of public health as well as teaching your courses. And kind of because of all these different things, we really like to express that we have a lot of hands-on learning opportunities for students. We have several different degrees. So we have a few MS degrees, biostatistics, population health, which is a fully online program, and industrial hygiene. We have an MHA, which has an online track and a residential track. We have the MPH, which has the 4 areas listed, and we have the online track for health policy as well as the residential track. And then we have the PhD program. So I'm just going to do a brief overview. If you are interested in any of these specific programs, I would encourage you to talk to me in the breakout room because I could dive a little bit further into them. So like a lot of the others on this fair today, we are on sofas, but not all of our programs are there. So depending on which program you're interested in, you may only be doing a WV application, and some of the other programs you'll be doing both. We use all the regular things, transcripts, letters of recommendation. The letters of recommendation will vary the number depending on which program you're applying for. Same thing with what they're asking for the personal statement. The GRE is not required for any of our programs, but some of them like industrial hygiene and biostatistics do have prerequisite courses that you'll have to take. And again, I can talk about those in the breakout room. Our deadlines are December 15th for the PhD program. All other programs are June 15th. The PhD deadline is early because we have all of our full-time accepted students are offered a fully funded stipend. So we need that time to be able to work out the funding aspect. Our other program that has a funding aspect based on merit is the MPH program. And again, I can go into further detail about that in the breakout room. So we have a lot of different things that we do at the School of Public Health. We're a smaller school, so we're still part of WVU, which is a 30,000 student campus. But the School of Public Health has about 300 students total from undergrad through PhD level. So you get a lot of one-on-one attention. We do a lot of student activities. We have our own director of career services who meets with students, keeps his own job board. He's pictured in the lower picture, and he also has alumni back for panels, that type of thing. We have our Student Association of Public Health, which is completely student run and organized, and they do a lot of different things, especially surrounding Public Health Week and APHA and all those things. And a lot of our students are involved in different research aspects. Like I said, a lot of them want to present research that they were working on. So